Hi, my name is Peter Law, and today I will be discussing about decision making at CEO level. At the beginning of 2020, the COVID-19 pandemic seems to pose a challenge to CVS Health, facing the risk of losing market shares to online direct retailers. However, as CVS experienced growth, its health benefits business witnessed a steady stream of consumer demand in pharmacy sales and health services in its store across the U.S. The president and chief executive officer of CVS, Larry Merlo, needed to outline a series of initiatives to show how the company planned to accelerate enterprise growth. One goal was to integrate health offerings and simplify the ability to deliver care to the consumer in the community, in the home, and in the palm of their hands. Another goal was to expand CVS present locations into health hubs with the focus on driving customer engagement through personalizations, providing high-growth products and services, and delivering new and innovative management solutions. CVS has started to combine with Aetna to build a powerful and unique business model that would become the most consumer-centric health company. The growth analysis here illustrates the performance of CVS in the second quarter of 2020. CVS missions and vision statements are customer-centered. Through its corporate mission and vision statement, CVS motivates employees to embody the company's values while supporting the strategic objective of the organizations. This business focus on strengthening the workforce allows CVS to satisfy the health needs of the customer in retail pharmacies and health services. The company also maintained employee retention in personal and professional development, which is essential in making the organization competitive. CVS is one of America's most dominant healthcare players. The company operates over 9,800 retail locations with over 94 million pharmacy benefits plan members who use CVS to file 1.3 billion Medicare claims in 2017. In an effort to increase its vertical integration even further, CVS announced in late 2017 that it was buying insurance giant Aetna for $77 billion. This deal would combine two very different companies, providing CVS with greater diversifications as the healthcare landscape evolved. CVS believed it would be able to achieve $750 million a year in cost savings by combining its massive network of pharmacy clinicians and pharmacy benefits management business with Aetna's nearly tens of millions insurance members. The Aetna's acquisition may make sense strategically in that it would make CVS the largest medical company in America and provide more health services diversifications. However, the deal was considered risky given its financials and operational risk. During the first half of 2021 alone, cash flow from operation exceeded 8.7 billion and 5.7 billion in debt was repaid during the same period, with long-term debt at 59 billion as of Q2 2021. CVS is on track to reach its deleveraging target at 2022 even without any additional earning growth. As the net impact improves synergies between CVS and Aetna increases, the reduction in net interest expense would continue to amplify the positive cash flow situations. CVS has experienced a clear benefit in both retail consumer spending as well as consumer resuming their trips to pharmacy visits. The revenue in the second quarter of 2021 were just over 11% higher than the second quarter of 2020. More specifically, healthcare benefits saw nearly 11% growth year over year. Pharmacy services saw about 10% growth year over year, and retail led the charge with over 14% growth. It should be noted that healthcare benefits and managed plans were largely unchanged by the pandemic and continue their regular growth in 2021. As more people become comfortable with going out and about, it is likely to expect a large number from store revenue growth. Overall, this was the best quarter CVS has presented to investors since the beginning of the pandemic. There are inherent risks, specifically the executive decision of the Aetna acquisition. CVS has arrived at the intersection where all the pieces are in place to realize cost synergies and their positive impact. For example, CVS has only just begun launching the products and services that will integrate its pharmacy and urgent care operation with Aetna, with hospital filled with the brink in the COVID-19 pandemic. CVS found itself addressing the shift in consumer behaviors. Instead of long trips to the hospital or those expensive copays at doctor visit, people can visit CVS Health Hub, which are close to most Americans. The accessibility of CVS allows them to work within the community to develop personalized solutions for the patient. The increased impact of CVS Healthcare has made it an attractive option for consumers than a hospital or a doctor office visit. Additionally, Aetna's Zero Copay at Minute Clinic, the main Health Hub product by CVS, makes the experience incredibly affordable. These health hubs have become so profitable that CVS announced strategic capital expansion to boost the amount location from 650 to 1,500. The executive team ability to respond to growing consumer trends display the strengths of the company when it comes to putting the customer first.